and that'll be for personal. I'm Dr. Mathew Abinante. I'm the owner of Elevated Health here in Huntington Beach. We're a direct primary care clinic, and when this whole COVID pandemic kind of hit, I wanted to be right out in front and do the testing. I had a patient that I thought had COVID. When I first started, patients would pull into the back lot, and I would don all my PPE, and this is the way we would go. Patients would pull down this very narrow driveway, and then I would come out and I would instruct them not to roll down the window, to look straight ahead, and then I would come behind the vehicle and they would crack the window this much, and I would just reach my hand in like this and do the swab. And so I said, I'm gonna swab your nose and run away, and don't be offended. It's a really awkward visit, but I'll get back to you in 2 days with the results. And then I saw how big this was gonna be, the need, and I saw that government really wasn't moving. I'm not critiquing them. The government is not big enough to save everybody. So I said, hey, I'm a small town doc, but I gotta do my part. We popped up here, I got permission from the mall owner, and here we are. We test about 200 cars a day. We have about a 7-hour wait every day, and we end up turning away cars. We're only able to operate 9 to 5. And the idea of a drive-through site where somebody just drives up to keep all their germs in their car, and then they come and get testing is really attractive for people, and we're able to help a lot of people that way.
I had symptoms in January, in early January, and I had a cough that lasted for like 3 or 4 weeks. So I thought it would be worthwhile to find out if I have the antibodies. For one thing, if I did, then I could donate my plasma, and for another, I wouldn't have to be so worried about, infecting someone or getting infected. If we wait for the federal government to come through with antibody tests, it could be months. $75 was nothing to be sure that I hadn't had it.
The rapid antibody test is a cassette testing for IgM and IgG, and that test is $75. Or the other test is a nasal swab. It's looking for the actual antigen, the actual RNA of the virus. PCR nasal swab is $125. So President Trump and all these local leaders say testing is free, nothing out of pocket. The insurance companies are going to cover it. Well, when you peel back the layers, getting down to the nitty-gritty as a doctor like myself in a small community, we can't get funding. So we had to go to a private model. We have close to 50 positives now. After today, we'll probably be close to 60 or 70. And all of those people, we check in on them frequently. We're sending medications. And I'm happy to report, fingers crossed, I don't want to jinx it, but we have no patients that have been hospitalized. My wife, we have 4 little daughters, and she was quite concerned and moved to San Diego to be about an hour away with her family, which I don't like to think about because it'll make me cry. You'll have to give me a few minutes to compose myself here. There's just been a lot of, as like a small town doctor, there's been a lot of vitriol and accusations online about me trying to create fear and be a profiteer, and that's really hard when I've been working 18-hour days and worry about being sick myself and not seeing my family. And so anyway, that's just kind of hitting me.
So before you get into the test,
I've put in probably about 40,000, and my friend had put in 200,000. We have a small operation here. Normally our family practice, that much debt, I'm not comfortable with that much debt, and that would bankrupt our company. I really hope I can break even. 1, 2, 3. Oh. Didn't hurt. So there's a control line. You'll always have one line. 2 lines would be IgG or IgM, and then the 3rd line would be that you have both. If it's negative, I'm hoping to test on Sunday morning and go see them for Easter, and I'll just have to wear a mask, and I miss my kids, and so I'm not going to cry this time. What would you do if I was positive?
well, you'll have to test me right away. But
it's negative.
Negative?
Yeah. In a way, it's disappointing. I keep telling patients this because, in a way, you want it to be positive for IgG and say, hey, I already got through it. I'm good.